Hello, everyone. My name is Nyla Hawkins, and today I will be discussing my case and intervention plan for my client. And just to let everyone know that the name that I use is completely made up due to confidentiality reasons. So, this is my client, Ingrid, and just to give you some background information on her, she is 76 years old. She is a retired seamstress. She is Italian. She enjoys painting, traveling with her family. She enjoys opera music. She has one daughter, and she sustained a right CVA stroke about 2 months ago. So, just to give you some more information about Ingrid, as I stated in the other slide, or in the slide before this one, she's been a resident at the Friendly Home for about 2 months. She previously traveled with her boyfriend to different countries before she sustained her stroke. She grew up in Italy. She owned her own business as a seamstress. And currently, she's having difficulties with ADLs and IADLs, specifically grooming, toileting, bathing, and meal preparation. And because she suffered or sustained a right CVA stroke, she's at risk for learned non use on the left side of her body. And one of the things my fieldwork educator expressed to me that if she's ever going to go back to an assisted living facility, she has to be independent in those ADLs and IADLs that I've put on this slide. So now we will move on to talk about goals that I've set for Ingrid. So goal number one, I stated that um, for her to perform self-feeding with her left hand. Um, so during my fieldwork observations, consistently I've noticed that she compensates with using her right hand instead of her left hand, which makes sense because of the right CVA stroke, left-sided neglect. So she's even reported that she's more comfortable using her right hand. Also, she leaves food on the left side of her plate for every meal that's given to her, which to me was very interesting for me to see because we had talked about that in class before. And also, another important thing to note is that she becomes agitated when she's encouraged to acknowledge anything or anyone on her left side. I remember when I first met her, I happened to be on her left side. As my fieldwork educator was introducing me, she didn't even see me or acknowledge me because of the left sided neglect. So I think that's important to always try to encourage that for someone in her case. So the approaches that I thought were appropriate for her was restore and promote. So I've also put another goal for her because this is, I felt was very important to know and something that she struggled with when I was observing her during field work. So I thought performing toileting with the use of both hands. So as I stated before, that she's strong in using her right hand, but when it comes to toileting, we want to implement the use of both hands. She's already doing it with her right hand, but again, the left side is what needs to be worked on the most because we want her to be safe when she's using the restroom and prevent falls. So to go further, she's having trouble using adaptive equipment in her left hand due to the non-use. As I stated before about falls, she has had maybe about 3 or 4 falls within the last 2 months at the Friendly Home when toileting. So it would make sense why she would have anxiety, which even more pushes the point why the left side neglect has to be addressed. And also to constant repeating by my fieldwork educator of putting her left hand on her walker when sitting and standing for toilet transfers also. And again, OTPF4 approaches, we want to promote her using her adaptive equipment, her DME, safely to prevent falls, and we want to restore as well. So now I will talk about the intervention that I've chosen for my client, which is task-oriented training, specifically constraint-induced movement therapy, shaping, and the transfer package, which I will discuss further in this slide. But first, I want to bring your attention to what is constraint-induced movement therapy, otherwise known as CIMT. It is a rehabilitation technique for hemiparesis that consists of restraining the unaffected upper extremity while intensively training the affected arm and hand to improve performance on functional motor tasks. So I just want to bring your attention to these pictures, specifically figure A. This client or patient in this picture, her hand, the unaffected hand, has the mitt on, which is her left hand, and she's doing a task of meal preparation by spreading the cheese on bread with a knife using her affected hand or affected arm, which is her right hand. So I thought that this reinforced why this intervention would be appropriate for my client, because if you remember in the previous slide, one of my goals for Ingrid was self-feeding with her left hand, which this client is doing but it's just with her right hand. It's the same concept. And as I stated, self-feeding is an important goal for my client. If you look at figure B, also, this client, she's pouring water into a cup for drinking with her affected side. So for Ingrid, it's, as I said before, it's the same thing. We want to encourage the left side of her body. So as far as implementing this intervention in treatment sessions, according to research, 30 minutes once a day for from 2 to 7 sessions a week for 2 to 12 weeks. That can always be adjusted. Every client is different, but this is what research has shown. Now I will go further into about shaping and the transfer package that's included in the CIMT intervention. So shaping is, as I said before, constraining the non-affected limb with a mitt to promote the use of the impaired limb. Transfer package is dealing with adherence enhancing behavioral methods designed to transfer the gains obtained in the patient's real world environment. So for Ingrid, she is a resident at the Friendly Home. So this intervention would be most likely done in her room or in the therapy gym, which has a kitchen, which is her environment. So that makes sense. So here I've listed research support that supports my intervention of CIMT. So there's been various articles that state that CIMT improves upper limb function following a stroke compared to um, treatment, to other treatment or no treatment at all. It's also found to have good internal consistency as well as reliability, and it also measures motor function of the affected arm and hand. And patients who have received this particular intervention have shown to have advantages over other patients who have not received this treatment or received intensive traditional therapy. And to me, this intervention makes the most sense for Ingrid, for her to be functional with her left hand. So here I just want to talk about my rationale for using task-oriented training, specifically constraint-induced movement therapy, shaping and transfer package. We want Ingrid to learn how to use adaptive equipment in the left hand. She's already shown that she's able to use a grabber with her right hand sufficiently, but we want to transfer those skills over to her left hand. As I stated before, all throughout the PowerPoint, that she mostly relies on her right hand and that she's at high risk for learned non-use of her left hand, which is a problem, and which the intervention that I chose should be implemented because we want to work on those specific things. We also want to help target the goal of self-feeding and other ADLs, as I talked about earlier in the PowerPoint, so the grooming, functional mobility, and toileting as well. And it's also important to note that she is motivated when her daughter comes to her therapy sessions. I know that's not always necessarily a good thing because we don't want her to be necessarily dependent on her daughter to for her to do the intervention or her to perform well. But to me it's a start. I don't necessarily see how it could be too hindering, but I could also see how it would be a problem as well. And lastly, just during my observations and conversations with my fieldwork educator, she has enough or sufficient active range of motion to complete the CIMT intervention. So here are my list of references. So thank you to anyone that was assigned to watch my video. If you have any questions, I will see you in the discussion forum, and we can talk about it in class when the time comes. Thank you.